Welcome students to the Unit 4. The Spirituality of Care Professionals and Nurses, Lecture 2, Different Interpretations of the Concept of Individual Spirituality. Spirituality is an evolving concept that has significance in relation to bodily health. It is also considered an aspect of health. Gone are the days when spirituality was limited to the esoteric. It has now been deemed to have practical applications, such as in nursing care. Spirituality is linked to the human spirit and is an important component of human existence. Many people consider their spirituality and religion as a crucial part of their existence. Spirituality also serves as a source of support and contributes to people's well-being and helps them cope with everyday struggles. Health professionals also recognize the part spirituality plays in the healthcare. Some authors go on to state that it is the holistic perspective on human functioning and in nursing which demands that nurses take into account aspects of spirituality when they provide nursing care. Nurses are primarily trained in the physical and nursing care of the patient. However, their levels of spirituality can also impinge positively on their care, for example, of the older person. Other studies have also shown how providing spiritual care is influenced by multiple factors, including the spirituality of the healthcare provider and their understanding of the spiritual practices of the patients. What can be the positive aspect of implementing one's awareness of the spiritual aspects of care? In this slide, we find some of them. For example, cultivation of more empathic and compassionate relationship with clients, their families and colleagues. Process of meaning constructions in relation to care, illness, healing, and death. Preventive factor against burnout and high work-related loads. Coping strategy. Instrumental to the delivery of spiritual care interventions. At the same time, we must not forget that although all individuals hold beliefs, these remain the prerogative of the private sphere of the person, both the patients and the caregivers. Therefore, it is important to be attentive to the critical element caused by the integration of spiritual aspects in care. We cannot forget that hospitals are secular spaces and they are open to people of all faith and belief. If the importance of spirituality is emphasized too strongly, it can be interpreted as an attempt to proselytize. This can happen both to the patient, but also to the caregiver. For example, when the patient is an important and well-known member of a cult. It can be seen as an intrusion of the private sphere into the sphere of competence and obligations of carers. This may even lead to their job competences being called into question. It may lead to a further polarization of the medicine versus religion dichotomy, which underlies the separation of body and spirit that the holistic approach would like to reintegrate and unify. It could be potentially divisive topic among both colleagues and patients and their family. It can have an impact on workloads and can be used as a discriminating element, as for example, in the case of a carer who is particularly devoted to a cult that only takes place in the morning on a particular day of the week, and who would therefore oblige the team to organize everyone's work according to their own needs. So, So far, we have looked at what is called intrapersonal spirituality or intrinsic spirituality, but there are other variations that may interest us. On this occasion, we will consider spiritual well-being in psychology and spiritual sensitive care in psychiatry. Spiritual well-being in psychology. There is some evidence of links between spirituality and improvement in people's mental health, although research does not know exactly how this works. The practice of incorporating the spiritual dimension into psychotherapy was introduced into Western psychology by Jung. However, spiritual well-being should not be confused with psychological well-being. Although these two dimensions are interrelated, psychological well-being focuses on the study of psyche, while spiritual well-being goes to the core of a person. Spiritual beliefs and practices can affect the way people understand health and strategies they use to cope with illness, their resilience, resources and sense of support, and overall health outcomes. By alleviating stressful feelings and promoting healing ones, spirituality can positively influence immune, cardiovascular, heart and blood vessels, hormonal and nervous systems. Scholars have conducted many studies and literature reviews on the relationship between religious spirituality and a wide range of physical and mental health conditions, including high blood pressure, cerebrovascular disease, heart disease, immune system dysfunction, improved ability to cope with cancer, chronic illness, longevity, and health behaviors such as in living with pain and disability and smoking prevention. Moreover, spirituality has received much interest in healthcare services, in which spiritual care has been considered as inseparable from physical, social, and psychological care, because together they form the whole. The other topic is spiritual sensitive care in psychiatry. In the field of mental disorder, it has been shown that religion and spirituality have significant implications for prevalence, especially depressive and substance use disorders, for diagnosis, example, differentiation between spiritual experiences and mental disorders, treatment, for example, help-seeking behaviors, compliance, mindfulness, complementary therapies, outcomes, for example, recovering and suicide, and prevention, as well as for quality of life and well-being. The World Health Organization has now included religion and spirituality as a dimension of quality of life. Although there's evidence to show that religion and spirituality are usually associated with better health outcomes, they may also cause harm, for example, treatment refusal, intolerance, negative religious coping. And many surveys have shown that religion and spirituality, values, beliefs, and practices remain relevant to most of the world population, and that patients would like to have their religion and spiritual concerns addressed in healthcare. So, we have quickly seen that talking about the spirituality of both the carer and the patient implies approaching the issue in a multidimensional way. One has to take into account both the intersubjective aspect of the individual and the relational aspects that contribute to constant redefinition of the concept of spirituality, which is not univocal and one way. In these two video lectures, the theme of spirituality was addressed, bringing out its specific features from the humanities and specifically through the lens of anthropology. We have also briefly reconstructed the history and complexity of the term spirituality and understood its different semantic variations. In the next video lecture, we will see in a more operational way in which context all that has been described so far can be applied. Thank you.